Are we able to show? Thank you. Do you want me to tell you to move on to the next slide? Thank you. So just by way of introduction, I'm here this afternoon, being invited by a panel to talk through the current consultation that's underway regarding Castle Grange and Claremont House. The aim of the afternoon is to talk through the principles, methodology and emerging themes of the public consultation. I'm not proposing to go through all of the slides because panel members have had individual packs, of which I'm sure that panel members will be asking questions further on. So if you just move on to the next slide. What I'm aiming to do this afternoon is to talk about overview of Castle Grange and Claremont House, the proposals that have been presented to Cabinet, and how we've asked people to get involved in that consultation process. But mainly what I want to concentrate on is emerging themes that have arisen from consultation with families, stakeholders, and other sort of emerging issues, and then go on to timeline and next steps. So next slide, please. So just by way of introduction and context, Castle Grange and Claremont House, two long-stay residential homes, one based in the south of the borough in Newsham and the other in the north of the borough in Hetmond-Wyke. Both homes are run and owned by the council, offering 24/7 residential care and support for people over the age of 55 who have a dementia diagnosis. Service users below the age may be accommodative if the establishment clearly meets the needs of those individuals. We have provision for 30 long-stay and short-stay beds. The service provides bedrooms that are single occupancy with en-suite shower facilities. I'd just like to note that Castle Grange is temporarily accommodating dementia daycare services. This has reduced the home's provision to 30 beds in total. 26 beds are currently occupied by long-stay service users and 4 beds are used for short-stay and emergency placements. Claremont House has undertaken a series of decoration, and this has reduced the home's provision to 30 beds in total. 20 beds are currently occupied by long-stay service users and 10 beds are used for short-stay placements. Thank you. Next slide, please. Again, by way of context, a report was presented to Cabinet on the 26th of September for approval to enter into formal consultation to close Castle Grange and Claremont House residential care homes and instead provide care through other care homes instead. The report asks for approval in principle, subject to stakeholder consultation, for the Council to withdraw from long-stay residential care market and the Council to focus direct care delivery in parts of the care market where there are fewer providers and options for people. This part of this proposal would involve consulting with residents and families and the wider body of care providers. It would also involve consulting with staff and unions around service re-provision. And it's fair to say we have done a series of pre-consultation meetings with families and and we are in regular contact with families through face-to-face meetings. The consultation aims to communicate clearly to residents and stakeholders the proposals for future of the dementia residential care run by the Council, ensure that all stakeholders who wish to comment on the proposals have the opportunity to do so, enable them to raise any impacts on the proposals that this may have, to allow participants to propose alternative suggestions and to provide feedback on the results of the consultation to elected members to enable them to make informed decisions about how best to progress. To ensure that results and findings are analysed in a meaningful, timely fashion so that feedback is taken into account when decisions are made. Next slide, please. Next slide, please. So I've skipped one. So what are we consulting about? As I've previously said, we're consulting on the proposals presented to Cabinet on the 26th of September to review and explore potential closure of the Council's long-stay residential care homes. I think it's fair to say the rationale for the proposals, the strategic aim of social care is to support people to live independently in their own homes for as long as possible. This is reflected in the significant expansion in reablement and home care capacity across Kirklees and the investment of a new dementia daycare service at Knoll Park House. In other areas of social care where there's a wider range of providers, the Council provides a small part of the total provision. Examples include residential, nursing, home care, where a vast majority of provision is provided by the independent sector. Thank you. Next slide, please. So this just gives you an overview of how people have been able to get involved. We've done this through a variety of means. We've got web pages that went live, we've got online surveys, we've provided paper copies of the surveys, we've provided advocacy sessions to support people to take part in the consultation. We've held face-to-face meetings with families and we've held aimed at families of the residents in the structured themes of sessions. Just to note that these have not been public meetings, but we've held several meetings with families. We've got a dedicated email address that has been set up so people can contact the council if they need. All inquiries are logged and dealt with in a timely manner. Next slide, please. So just to take you through the consultation timeline, we commenced the consultation, we commenced on the 9th of October. Through that period, we've done a variety of activities, dedicated sessions, as I've said, with home care residents, consultation with staff, with staff, with unions. We've also consulted with our dementia practitioner and the News and Community Forum. Engagement with care home providers throughout the engagement, and also seeking feedback from families of the care homes to ensure a full, open, meaningful dialogue throughout this consultation process. The consultation ends on the 3rd of January and results of that will be presented to Cabinet in February 2024. I just want to touch now on some of the emerging themes of the consultation survey. We've received 100 plus responses to date, and some high-level themes from the survey do include identifying council savings and efficiencies through other initiatives to help protect social care, impact of the proposals on residents, families' health and well-being, and short-term and both short-term and long-term, recognising the good quality of care provided through Grange and Claremont House, and identifying equivalent high-quality choices in the wider care home provider market. Impact of the council no longer being a provider of residential care for older people with dementia, and balancing the need for financial savings with the human impact of the proposals. Detailed feedback will be shared with the committee after the consultation closes. Just want to go on now, next slide please. Sessions with families, some initial feedback. Like I've said earlier, we've been doing a multiple of face-to-face meetings.
Your slides are out of sequence.
Oh, I'm so sorry. Sorry. Next slide. So sessions with families. Thank you. I'll slow down. I know I talk very, very fast. Apologies. So sessions with families, some initial feedback. We have done a multiple of face-to-face meetings with families, and we've held those at Grange and Claremont House, and that was before and during the consultation period. We held a pre-consultation briefing with families, recognising that not everybody was aware of that, so we've offered to do several face-to-face meetings with families depending on what their needs have been. Subsequent meetings have focused on understanding the council's preferred model, understanding the cost and benefits of options explored, the impact of the proposals on residents' wellbeing and family wellbeing, and identifying and appraising alternative options. Some high-level emerging themes from these sessions have included concern about the proposals, review of the settings with a view to closure of the in-house dementia care homes, and alternative options to be explored in the private sector. Families are seeking assurance that the private sector can deliver the same high-level quality care and specialism in dementia care, and identifying council savings and efficiencies through other initiatives to help protect social care services, and then questions about the council's investment in other services. An open dialogue about options explored and financial models used to arrive at the proposed council model, and impact of the proposals on residents' families' health and well-being, both short and long term. Next slide, please. Thank you. So some emerging themes for discussions with stakeholders. We've consulted with staff working across all care homes, wider teams across council services, partners including the NHS, the Dementia Hub, and wider community sector organisations and the care provider market. And we have had discussions with Kirklees Care Association, but taking into account that families chose not to have Kirklees Care Association at those family meetings, and we did take that into account. Some high-level themes today emerging from stakeholders include concern about the overall availability and sufficiency of dementia residential and nursing care beds in Kirklees, the need for additional investment in the workforce to support with specialist dementia care, impact of the demographic change and the importance of early intervention and prevention service, recognition of high-quality environment and high-quality care to support provided by staff across both Castle Grange and Claremont House, the role of the independent sector in the provision of care and support and the impact of the council stepping out of this segment of the care market, and ongoing engagement with care home providers to explore ways of working and models of care. And next slide, please. So impact assessment, we did an initial impact assessment. We have reviewed that impact assessment, and you'll see from the slide there are some emerging themes around some of the impacts of that, age of the elderly, disabled individuals, gender, and that is to do with most of the employees are female and potentially at risk. People in poverty and low income, majority of the staff affected are low paid workers who may only be a source of income for their household, and access to services, choices of channels. All service users have dementia, and the majority, if not all, will not have the capacity to understand the process. Many have legal representation through power of attorney and who act on behalf of the family, of them or of the family, and will ensure that we engage with those at the early stage of any proposed service change. And the last slide just goes through the timeline, which I've already described. So the consultation started in October, will end in January, and we will present to Cabinet the findings of that, including the session with Scrutiny, and Scrutiny's recommendations will all form part of the Cabinet report that will go in February next year. So the last slide, on to next step. As I've said, the consultation closes on the 3rd of January. We are still in the midst of consultation. We will continue to engage with family members through ongoing communications and dialogue for the duration of the consultation, ongoing focus meetings with family members and other stakeholders. These meetings will be driven by the consultation needs of families, ongoing consultation with staff to gather their feedback on the proposals, attendance at key meetings, including Dementia Practitioner Forum and News and Community Forum, engagement with care providers through engagements with Kirklees Care Association, and consultation results to inform the final Cabinet report on the future of the homes, with a view to the meeting in February 2024. Thank you, Chair.
Yes, thank you for that.